Hello everyone. Today I wanted to discuss about the postoperative recovery of ankle replacements. Ankle replacements are a relatively modern approach for end-stage ankle arthritis. Ankle arthritis means that you basically have lost the cartilage, which acts as a padding in your ankle joint, and this can cause a tremendous amount of pain. The two main types of treatments historically for ankle arthritis are an ankle fusion, where you remove all the cartilage and the arthritis and you basically glue the bones together, losing the range of motion of the ankle, or an ankle replacement, where you replace the degenerated cartilage and bone with metal implants and a special type of plastic between those two implants. And the ankle replacement does retain range of motion. Specific to the ankle replacement, this is a procedure that can vary in terms of post-op protocols based on who does the procedure and where it's being done, as well as on the type of insurance that you have. Certain insurances, for instance, require that you spend a day or two in the hospital after surgery, while others are okay with patients being sent home the same day. Whenever possible, I like to send the patients home the same day and recovering in their comfort of their environment. This is not only beneficial from a psychological standpoint, but it can also decrease the risk of hospital-acquired infections, which can threaten the longevity of the ankle replacement, as well as obviously preventing even very short-term complications. So I always try to send patients home the same day, and I'm able to do this with a very special and tailored protocol as far as pain management is concerned. So what we do is we provide a very special type of anesthesia to the leg that lasts for 2 to 3 days. So for 2 to 3 days, patients experience very little or even no pain at all. Because the majority of the pain and of the inflammation occurs in the first 72 hours from surgery, this specific type of anesthesia is really able to tackle the problem. After these 3 days, rather than giving patients large amounts of narcotic and opioid medications, I've developed if you want, a cocktail of very different types of pain medications that don't interact with one another, but that can offer a very comprehensive approach to pain. And so it tackles pain at very different levels, from the perception of the pain to the nerve transmission of the pain. Being able to send the patient home with minimal pain is therefore crucial to send the patient home in the first place. Again, this can vary substantially among orthopedic surgeons, and so I encourage you to talk to your orthopedic foot and ankle surgeon to understand what his or her approach to this is. Now, if you have to stay in the hospital, many times you can still get this special cocktail of medication as well as the special type of anesthesia. And on top of that, you can have other types of pain medications given to you. One of these delivery methods is called an IV PCA, which basically means sending some pain medication directly into your bloodstream for an almost immediate pain control. Again, with these new protocols, this seems to be less and less necessary for the vast majority of patients. There are then other patients that really do need to stay in the hospital after surgery for, be it social reasons, meaning that they don't really have much help at home, or they have homes with multiple steps or stairs and they're unable to handle it on their own. A minority of these patients might require to go to a rehab facility for a few weeks before they're comfortable enough going back home. Usually 2 weeks after surgery, depending on the type of ankle replacement and ancillary procedures that might have been performed at the time of surgery, most patients are usually allowed to walk in a surgical boot. And at this stage, really, the recovery starts to speed up substantially. By 2 weeks, it's unusual for patients to really require particularly strong pain medications. Usually by 6 weeks after surgery, I allow patients to go back into a comfortable shoe, most commonly a sneaker, and start a formal physical therapy rehabilitation program to start working on ankle range of motion, strengthening, and balance, gait training, proprioception, etc. At 6 weeks, I also encourage patients to start doing some light physical exercises, for instance, a stationary bike or the elliptical, but as a minimum, really moving the ankle up and down at home whenever possible, when you're watching TV, when you're at the dinner table, if you're at work, when you're at your office desk. So if you guys have any questions, feel free to reach out to me. If there's anything in particular that you'd like for me to discuss, I'm happy to do so. Take care.